Welcome back to another Level Up Health video. If you're new to the channel, be sure to hit that subscribe button as I'm always dropping new and exciting content to better your health. Thanks guys. Now in this video, we'll be going over the top 10 scariest risks faced by diabetics. So let's jump right into it. According to the World Health Organization, diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Insulin is a hormone that regulates blood sugar. Hyperglycemia, or raised blood sugar, is a common effect of uncontrolled diabetes and over time leads to serious damage to many of the body's systems, especially the nerves and blood vessels. In 2014, 8.5% of adults aged 18 years or older had diabetes. In 2016, diabetes was the direct cause of 1.6 million deaths, and in 2012, high blood glucose was the cause of another 2.2 million deaths. Between 2000 and 2016, there was a 5% increase in premature mortality from diabetes. In high-income countries, the premature mortality rate due to diabetes decreased from 2000 to 2010, but then increased in 2010 to 2016. In lower middle-income countries, the premature mortality rate due to diabetes increased across both periods. By contrast, the probability of dying from any one of the four main non-communicable diseases such as cardiovascular disease, cancer, chronic respiratory diseases, and diabetes between the ages of 30 and 70 decreased by 18% globally between 2000 and 2016. Now, let's jump into the top 10 countdown of the scariest risk factors that diabetics have to potentially face. Number 10. Psychiatric disorders. Diabetics may experience many different emotions such as anxiety, anger, and depression. Patients risk suffering from psychiatric disorders such as delirium, substance abuse, mood disorders, and anxiety disorders. That is why managing your mental health will therefore lead to better diabetes control. Number 9. Nerve damage. Uncontrolled diabetes may result in nerve damage. The high blood glucose damages nerves in the arms, hands, legs, and feet. If left untreated, diabetics could lose all sense of feeling in affected limbs. Patients should watch out for loss of feeling in their feet, numbness, tingling and burning sensations, and muscle weakness. You can better prevent this by practicing good blood glucose control, regular exercising, and by quitting smoking. Number 8. Foot complications. Nerve damage and damage of the blood vessels in the legs and feet of diabetics cause poor circulation, which leads to patients developing foot problems. An innocent blister on your foot can become a serious infection if left untreated. Severe damage may lead to a toe, foot, or even worse, leg amputation. Number 7. Gastroparesis. Gastroparesis is when the muscles of the stomach stop functioning properly. It is a condition that reduces the ability of the stomach to empty its contents, and it does not involve a blockage or obstruction. Number 6. Eye complications. Diabetes can damage the blood vessels in the retina, which may lead to blindness. People with diabetes may also develop eye problems like glaucoma, cataracts, and diabetic retinopathy. If your eyesight is becoming blurry, if you see shadows or floating spots, or if you're having trouble seeing at night, you should consult your doctor immediately. Number 5. Kidney disease. High blood glucose levels due to poor control can lead your kidneys to being overworked, which can lead to kidney disease. Severe cases can lead to kidney failure or irreversible end-stage kidney disease, requiring patients to undergo dialysis or a kidney transplant. Signs of kidney problems can be things like increasing amounts of protein in urine, water retention in the ankles, abdomen, and chest, a foul taste in the mouth, vomiting, and tiredness throughout the day. Number 4. Hypertension, aka high blood pressure. Due to the hardening and narrowing of the arteries, a diabetic's heart has to pump harder than normal, and this builds up pressure against the artery walls. Symptoms of this are frequent headaches, blurring vision, and shortness of breath. To reduce the effects of this complication, you should eat a low-fat and high-fiber diet, exercise regularly, quit smoking, and keep a healthy weight. Number 3. Heart complications. Diabetes causes an increased narrowing of the arteries and also the hardening of the arteries, which slows down blood flow. Diabetics are at risk of heart problems such as coronary artery disease, meaning the blood supply to the heart muscle is diminished, which is the main cause of heart attacks. Number 2. Stroke. Diabetics can suffer from strokes when the blood flow of the brain is blocked. This happens due to the hardening and narrowing of the arteries in the brain. If one's blood pressure, cholesterol levels, and blood glucose levels are not controlled, the risk of stroke increases significantly. Number 1. Hyperosmolar hyperglycemic non-ketotic syndrome. That is a mouthful to pronounce, but easily abbreviated down to HHNS, meaning where the blood glucose levels shoot up too high and your body tries to get rid of the excess sugar by passing it through your urine. The symptoms include high blood sugar levels over 600 milligrams per deciliter, dry and parched mouth, extreme thirst, high fever, warm and dry skin, sleepiness or confusion, loss of vision, hallucinations, dehydration, and weakness on one side of the body. This potentially life-threatening emergency condition mostly occurs in older persons with either type 1 or type 2 diabetes, which is not controlled properly. It is often an onset of a serious illness or infection. If HHNS continues, it can lead to severe dehydration, causing seizures, coma, and eventually death. That's it for this video on the top 10 scariest risks faced by diabetics. Let me know in the comments section down below if you or anyone you know suffers from diabetes and might have had to deal with any of these issues. But as always, thank you for watching. If you enjoyed the video, please hit that like button and consider subscribing to the channel. Thanks guys, see you in the next video.